Yep, so welcome. Now we're going to speak specifically about the Mental Health Nursing Transition to Practice program available through North Metro Health Service. We already introduced ourselves, but those of you that may just be hopping on now, my name's Dominique and this is my colleague Liz. We're both staff development nurses in the education and training team at Mental Health Services in North Metro. So if I may begin with acknowledgement of country. We acknowledge the Noongar people as the traditional owners and custodians of the land on which we work and pay respect to their elders, both past and present. North Metro Health Service recognises, respects and values Aboriginal cultures as we walk a new path together. So this is our new logo, which I think is quite nice. It's the Mental Health We Care. The Mental Health Transition to Practice program for both RN and EN provides you with an opportunity to build your knowledge, skills and confidence in mental health nursing within a supportive and structured program. So why choose our Transition to Practice program? Well, we've already ascertained in our earlier presentation that North Metro contains WA's largest mental health service. We provide care to youth, adult and older adult. Therefore, your career pathways and opportunities are quite diverse and varied. Our services are also delivered through inpatient units, community mental health clinics. We've also got day therapy and outreach programs to a catchment area of almost 1 million people. We've also got statewide and tertiary mental health services, which include things such as research, the forensics, neurosciences, art therapy, eating disorders and other specialised services. So it's quite a diverse area of work to come into, to be honest. Sorry, clicker.
Technology. You have to be good at technology, okay, if you come into nursing now.
I'd just like to give you a little brief overview of where we currently sit with North Metro vision, mission and values. So our vision is to be a trusted partner delivering excellent healthcare for our people and our communities. And we'll do this by promoting and improving the health of our people and our communities. But how can we drive that mission and our vision with our behaviours if it's not brought to life by our values of care, respect, innovation, teamwork and integrity? And it was only just a few years ago that we reviewed and changed our values. And the great thing about it was that these values were all led by the people on the floor, frontline healthcare workers. These are the values that we decided that we think are the most important within our service. A little bit on our strategic priorities and plan. Currently, we've got a strategic plan 2020-2025, so it'll be finishing soon, but it's based on considerable staff, stakeholder, community, executive board in investment. So you can see on the board there, I mean, to be honest, if you're interested in coming to do a transition to practice program within North Metro, with any service actually in WA, it's always in your best interest if you were to hop onto their website yourself and do a little bit of investigation about the service, the different things that they provide and all those sorts of things. But I mean, we hope over the next 5 years to enable more healthy communities, ensure that we're doing person-centred care, that we're integrated and connected, that there's innovation and more adaptive models of care, and that we are trusted, engaged and quite capable people, and then obviously being sustainable and reliable. So what does the transition to practice program mental health at North Metro comprise of exactly? Well, as a newly qualified RN and EN, so as I said, you get that opportunity to consolidate your professional practice in a really supportive and caring environment. The program is also structured. You'll spend the first 2 weeks of your employment in sort of induction, orientation and onboarding. And within those 2 weeks periods, you get some study days, plus you get 2 supernumerary days on the ward in which you'll first be allocated. So you're working, you're getting paid to work a shift, but you're essentially going to have a buddy with you that entire time, whether it's from the preceptor allocated to you at the ward or from your NQN staff to SDN nurse who will pop down and you know, sort of walk you through those first couple of days on site. Our Director of Nursing, Marianne Slethery, said the course is designed to educate, support and guide newly qualified nurses in their transition into nursing within the mental health sector, but also into professional practice. You attend specialised days to provide you with essential knowledge required within the mental health area and receive assistance from a dedicated support team. We've got one of our current NQN support nurses, Zoe, so she loves working with nurses. She watches their knowledge and skills improve, their confidence grow, and they learn such amazing aspects of the job. So we've got two programs, one's for an RN and one's for an EN. The reason we've separated it is that for those of you that are registered nurses, you'll be getting a 1-year, 12-month contract of employment with 2 to 3 clinical rotations, but you're also in partnership with ECU, where you undertake 2 units funded of postgraduate education. Those first 2 units are funded by the Chief Nursing and Midwifery Office. You get access to ongoing PD days, supernumerary clinical practice at the commencement of your job, excellent support from experienced mental health nurses and educators, and you'll have a rotational roster, which may include day, afternoon, and nights. Currently, as they sit, the maximum amount of shifts across a fortnight, you'll work at 0.8, which is already a 64-hour fortnight. Your postgrad inclusions include you enrol in a Master of Clinical Nursing with ECU, but you may exit the course with a grad cert in clinical nursing, mental health, on completion of 3 20 credit point units. So the first 2 units, contemporary issues in mental health and assessment in mental health, everyone has to do those. Those are the 2 units that are funded by the CNMO. The third unit, where you get to choose an elective, you can either choose community mental health, forensic mental health, child, adolescent and youth mental health, or drug use and addictive behaviours. The cost of that third unit is the responsibility of you, the applicant. However, you can apply for grants through the Nursing and Midwifery Office for support for the remainder of the course. But for further information and fees, please contact ECU via their website. ENs, you still also have a 1-year contract, 12 months. You're going to have 2 6-month rotations, access to ongoing PD days. You will also have 2 days of supernumerary supervision at the start of your rotation, excellent support, and also a rotational roster, which may include day, afternoon, nights. You're also at that 0.8, 64 hours a fortnight. So where are you going to work? For the EN, you're going to be, options are Greylands, the State Forensic Mental Health Service, so Franklin Centre. So Charles Gardner Hospital Mental Health Service, so that could be MHU or the MOA. You've got Osmond Park Older Adult Mental Health, and you've got Lower West Older Adult Mental Health, which we still refer to as Selby. For the RNs, though, you've got a bit of variance. So some of those other services, but there's a possibility of working at King Eddie's, the mother baby unit, and also some of our community mental health services. If I could just let you know that you don't get to pick these on your Grad Connect application. These are when you're shortlisted and come to interview that some of your preferences will be discussed. Lots and lots of staff benefits when you come and work for a big government organisation. Just a few of those that are listed up there, but don't forget you'll get things like your government benefits, the GECO, quality improvement activities, a way to drive our innovation, access to psychiatric services library where you can get all your journal articles, lots and lots of resources, completely free, and the people that work in there are so very helpful. Things like salary packaging, we've got IPC, infection control down here, so you can get your flu, vaccinations, all those sorts of things. Lots to do with wellbeing. Hop on the website and there's lots of activities, exercise. You get a sort of like a gym card where you get discounts, those sorts of things. So lots and lots of perks to coming to work for a big government organisation.
Also, can I just say there's ongoing professional development as well that you can do. We have a wide range of subjects and education sessions.
Yeah. And protected professional development leave where you can source external courses, etc., that you want to go to, and we're more than supportive for people to attend those. Just before we finish up, we're just going to give you a couple of statements from previous and current nurses about their transition to practice program. So Grad EN, Eda McChrystal, said that the transition to practice program gave her the opportunity to learn new skills in a safe environment. When I started, I was excited but incredibly nervous. My staff development nurse would reach out a few times a week and work alongside me in the ward, which made me feel more confident. I was provided with resources on topics I didn't understand and encouraged to apply critical thinking and experience to situations. The support made me feel excited to come to work and care for my patients. Firstly, I'd like to thank everyone for providing so much support in my journey of transitioning as an NQN nurse. I had a great experience in both my rotations during this program. Study days help me to get better understanding and help me to provide better care. During this year, I have learned a lot, and all thanks to the lovely staff in both places who are keen to teach and help me to learn from my mistakes as well. All the support and lovely team made this year memorable for me. So thank you for doing that and making my transition easier than I thought. I'll skip to the last one. I have found the NQN program with North Metro Mental Health to be useful as a supported start to my career in nursing. Even though I have been fortunate to work with within supportive team environments, it has always been great to know that I have an NQN support nurse whom I can ask for further support and resources as needed. The program included a postgrad cert in mental health and encouraged me to develop the important skill of clinical reflection. If there was anyone who was unsure about applying for an NQN program, I'd strongly encourage them to. You won't look back.
It is a really good program, and the staff that are the newly qualified nurses support are brilliant. They are so dedicated, and they love to teach and encourage everybody to learn. So it is a fantastic program. We're giving you details of where you can contact us for further information. Also, if you would like a tour around our facilities, please don't hesitate to contact us, and we can arrange that. Okay, but it's such a worthwhile program to come on. It gives you such a good standing in the rest of your nursing career. So hopefully we'll see
you soon.
Yeah.
Thank you.
Okay.